Good afternoon. My name is Tom Gaither. I am a fifth-year urology resident. Today, I'm going to talk about my research measuring anorectal sexual function among people with prostates. So, receptive anal intercourse is a taboo subject. However, receptive anal intercourse is very common, with about 10% of all men in the United States, regardless of sexual orientation, have undergone receptive anal intercourse at least once in their lifetime. Receptive anal intercourse is very common among men who have sex with men and gender diverse individuals. There is a patient desire to know more about receptive anal intercourse and how our treatments may interfere with this. Gay and bisexual men diagnosed with prostate cancer feel that there's a lack of interest or knowledge among providers. And the last reason why I think receptive anal intercourse is an important thing to study is that the scientific understanding of is very, very limited, and I think that is creates a new area for discovery. This was a recent this is a review article that talked about how prostate cancer can uniquely affect gay and bisexual men, ranging from things like anal dyspareunia, which is severe pain with receptive anal intercourse, climacturia, and ejaculation, erectile dysfunction, etc. But there's a lot of things that are unknown regarding to receptive anal intercourse and how prostate cancer may affect it. So what is anal dyspareunia? Well, there's no standard definition in the literature. Some people just use it's pain severe enough to discontinue intercourse. But there are been some studies on this in the past, and lack of lubrication, performance anxiety, as well as hemorrhoids or fissures can lead to pain with receptive anal intercourse, in addition to prostate cancer treatments. But we don't have any idea of really where this pain is occurring and why, and how we could really help people. Of course, sex is very complex, and there's lots of lenses to sex. So to study something like this, especially because it's so new, we took a qualitative approach. So overall, the research aims in year one was we began with a qualitative study, and we asked the main general question is, what contributes to receptive anal intercourse pleasure, pain, and why do people do it? And the overall goal for year two is, can we create questions to assess anorectal sexual function that are both reliable and valid? So the results of the year one have recently been published in the Journal of Sexual Medicine. I'm going to briefly go over those results. This was a multi-method study where we did both focus groups and one-on-one interviews to see where there were patterns or trends in the data among respondents. We recruited patients from the internet, as well as in the LGBT Center and the UCLA Gender Health Clinic. And we performed semi-structured interviews with an interview guide where we talked about pleasure, pain, erection, and orgasm. We talked about preparation for receptive anal intercourse, as well as sexual satisfaction and body image. And anatomy was very central to the conversation. We kind of got down to the nitty-gritty and really tried to suss out exactly where people were feeling different sensations. And we did a qualitative analysis where all transcripts were transcribed verbatim, and they were hand-checked for accuracy. And we reviewed them and, again, looked for themes across different data sources. And overall, we helped to create a language of pleasure and a language of pain that people use in order to describe these different sensations in different areas of the body. So here's an example of some of the words that people use for pain in different areas. And overall, our first conclusion is that there are a variety of sensations that make receptive anal intercourse pleasurable for people, and it's not all the prostate. Conclusion number two is that both mild to severe pain can occur during receptive anal intercourse, but it was overall not part of the typical experience. And location and timing of pain may help inform areas of intervention. And of course, the power of language is important. There really isn't a language to talk about sensations that people experience during receptive anal intercourse. And this was the sort of first paper to kind of help with that. So from that data, we began creating items for a survey that underwent further cognitive testing. And we're now sending this survey out to a larger audience to see if we can quantify some of the relationships that we uncovered in the qualitative data. So in order to be eligible for the survey, you have to be at least 18 years old, born with a prostate. Again, we're focusing on the male natal pelvic anatomy. And if you engage in receptive anal intercourse within the past 6 months, you are eligible. And so far, a little over 1,000 people have filled out the survey. The median age is 32, and it ranges anywhere from 18 to 97. And the majority of these participants are in the United States, but there's a good amount from Europe as well. So that is ongoing and what I will be working on in the future in the second year. But overall, I wanted to say thank you to Dr. Litwin, who is my faculty mentor, and the rest of the people here on this slide. This work could not have been done without them. So thank you very much.